Hey y'all, it's Kosta. I help people break the system to build a better future. Today we're talking about what happens when the public health emergency finally ends. If you didn't know, states are required to keep people enrolled in Medicaid throughout the COVID-19 public health emergency as a condition of receiving a temporary increase in the federal share of Medicaid costs. When the public health emergency ends, currently slated for April of 2022, the enhanced federal funding will end and states will resume administering renewals for Medicaid eligibility, some of which have been pending for more than 16 months. Nearly all 80 million people enrolled in Medicaid will have their eligibility redetermined, triggering a high risk of coverage losses that is almost certain to fall disproportionately on Black and Latinx individuals who have experienced significant harm and dislocation during the pandemic. Several factors are combining to make the upcoming Medicaid eligibility redeterminations incredibly troublesome. Medicaid enrollment has grown quickly during the pandemic. From February of 2020 through May of 2021, total Medicaid enrollment grew by 18.7% on average. That's insane. Medicaid and the Children's Health Insurance Program have added nearly 10 million individuals since the beginning of March 2020. And getting through the large numbers of redeterminations is a huge undertaking made even more challenging by so many people moving or losing housing due to the pandemic or natural disaster. While CMS has issued guidance allowing states 12 months to conduct the necessary redeterminations, states will not be able to maintain the 6.2% enhanced federal match once the public health emergency ends. And the loss of additional funding, this is important, could prompt states to rush the process. The U.S. Department of Health and Human Services can extend the public health emergency in 90-day increments, but the likelihood of the public health emergency getting another extension is very bleak. Continuous Medicaid enrollment has allowed people, including many people of color, to retain coverage and get needed care during the pandemic. When the requirement ends, most people will likely continue to be eligible for either Medicaid or marketplace coverage, but a massive number of renewals will test the system. Up to 15 million people, including nearly 6 million children, are at risk of losing their Medicaid eligibility when the protections expire. Without the expansion of Medicaid in 12 states, millions will be put in danger of having no alternative coverage. Every level of government, as well as the health sector and community partners, should help plan to ensure the end of the public health emergency doesn't push millions of people into the ranks of the uninsured and create even greater health disparities.